One of the leading killers for North Americans is still heart disease and stroke. How do we best protect ourselves and our families to help us enjoy healthier and longer lives? Dr. Dennis Modry may have a few suggestions for us. Dr. Modry is a pioneer of open heart surgery in Alberta. He implemented Western Canada's first heart and lung transplantation program. He also served on numerous hospital committees and successive Alberta Conservative Government finance committees. He's also been a director of several public companies and has been a member of the editorial board of the Journal of the Heart and Lung Transplantation. Dr. Modry, that's quite an introduction, and welcome to Bridge City News.
Thank you very much for the invitation.
Now, Dr. Modry, with your expertise in heart and lung health, why do you think nurses are reporting to us here at Bridge City News that they're seeing an increase in heart and lung issues from certain people who have received the mRNA vaccine?
Well, that's a very good question. We know, for example, that individuals, particularly younger individuals, males in particular, have been prone to develop a form of myocarditis and pericarditis. And this has been somewhat worrisome. And of course, it's changed the perspective that the FDA and the NIH have had with respect to the implication or the implementation of these vaccines for younger people. And I think it's part of the reason why, as well, that a lot of younger people have been shying away from becoming vaccinated because they are aware of this particular problem, particularly in younger people.
Is it more common than we realize, or is it like maybe 1 in 10,000 or 1 in 50,000?
Well, I think you can look on the CDC website, the Vaccine Adverse Event Reporting System, and that gives you some sense of the scale of the problem. But part of the difficulty is, in terms of answering that question accurately, is that there's no mandate for reporting adverse events from the vaccine. So we're just guessing in terms of the scale of the problem. But suffice to say that the fact that it is being reported at all is, number one, worrisome, and two, dissuasive for younger people in particular to become vaccinated with any of the COVID-19 vaccines, particularly Moderna right now, I expect.
Now, the Centers for Disease Control and Protection in the United States says if a person is immune to measles, that person should not receive a vaccination for measles. Is the same true for other diseases or viruses such as COVID-19?
Well, I believe that to be the case. I mean, if you've been exposed to COVID-19 already and you've survived it, and obviously the probabilities of surviving are nearly 100% for most categories, particularly under 70. If you've been already exposed, we know from history in terms of other people being infected with various viruses that the immunity that is generated is extremely robust and long-lasting. And the evidence isn't out there yet to prove that if you've had COVID-19, that you should subject yourself to becoming vaccinated with the potential risks associated with being vaccinated, notwithstanding death. And I might just say that, you know, it's amazing to me to think that in the last 30 years, taking deaths from all vaccines being in the order of 3,000. And here we are just with COVID-19. And you can look at the CDC website and you'll see that just in the US alone, there's 16,000 deaths. Well, previously, you know, would there be 25 or 50 deaths that would occur from a vaccine? The FDA would stop the continuation of using that vaccine. But here we are with over 16,000 deaths in the US and many more around the world. And we're just piling on with even more and more vaccines and now boosters. Where it all ends, who knows? But I suspect that what we're seeing in Israel and in other areas, that there's going to be an increasing amount of people who are vaccinated, not just who get COVID-19 or a variant of it, but I'm worried that there may well be increasing numbers of deaths in people who have been vaccinated who are then exposed to a variant. Whereas if you hadn't been vaccinated, you would have more broad-based immunity because simply when you've had COVID-19, you develop antibody to the entire virus, as opposed just to the spike protein, which is engendered by the various vaccines. So it's going to be very interesting to see what happens over the next couple of years, and I hope I'm wrong, and I hope that the very esteemed virologists around the world are wrong, that there will be many more deaths in the vaccinated than in the unvaccinated.
Dr. Modry, we're receiving reports here at the station that certain AHS staff are refusing the COVID-19 vaccine and some are even quitting as a result. So how will the health authority handle a situation like this? I mean, we already have a shortage of doctors and nurses here in our province.
Well, that's an incredibly important question, but let me answer it by, first of all, giving you a little bit of background. Many of those healthcare workers who I've worked with for 30 years, they were there on the front line, not being vaccinated. Many of them may have developed COVID and didn't even know it because a lot of them were young and healthy. So they were there on the front line, and now they're being told that unless they get a vaccine for which they have legitimate concerns about with respect to myocarditis, death, clot formation, central venous thrombosis, splanchnic venous thrombosis, et cetera, Bell's palsy, and all kinds of other potential problems. And now they're being told that they have to be vaccinated when they've worked for 18 months without being vaccinated. It really doesn't make any sense. And to think that, the government would mandate that they have to be vaccinated or they're going to be fired, I think is an egregious step in the wrong direction. And I think it breaches every thought of normality and morality and individual rights. So I think it's a colossal error and it's a backward step. And it's only going to create further problems, further delays in people accessing the healthcare system. As you probably know, Hal, one of the chief problems of our Canadian healthcare system, the way it's constructed under the Canada Health Act, is the problem of waiting to access the healthcare system. This is just going to make it a whole lot worse for many people who need to access it. They're going to die before they get in the system. It's a terrible, terrible policy, and it should be rescinded.
So, Dr. Modry, with everything that's transpired, do you think this could potentially lead to even more private health care?
That's an extremely excellent question. And, we already have a great deal of private health care now. But I could see, for example, particularly on the reservations, for example, which is immune to whether or not you have public health care or private health care. And on the reservations, you can set up private health care. I could certainly see this being something that could move forward in a fairly rapid fashion. However, to build hospitals and really to build an infrastructure, it would take a number of years and a lot of money. But I certainly think that it is possible. And I rather expect that many of the people who are going to be offloaded from the healthcare system because of government policy, we're going to be looking for employment in private clinics and surgery centers and that sort of thing.
So, Dr. Modry, why do you think that some of the numbers Alberta Health is posting when it comes to COVID-19 deaths and maybe some of the numbers of the ICU beds, the shortages of beds, may differ from what we're actually hearing from certain frontline workers?
Sure, those are two important questions. The first question is that many of the deaths that have occurred, in fact, probably in order of 90 to 95% of the deaths that have occurred did not occur as a result of COVID-19. They occurred as a result of the underlying condition. And the reason we know that, for example, is that the PCR test that was used to make those diagnoses is notoriously wrong, particularly at cycle thresholds over 30. And they were running cycle thresholds 35 to 45. So the diagnosis of COVID-19, for one thing, was completely erroneous. So, and when you look at it from another perspective, the average age of death for individuals with COVID-19 is 82. The average age of death in the general population is 81. So you could interpret from that you have an advantage, a life expectancy advantage by having COVID-19. So it's ridiculous to think that COVID-19 has been the cause of death, but it has been the cause of the lockdowns, and the lockdowns itself has caused many more deaths. Now, the issue of ICU beds and hospital beds, the rubber meets the road in the ICU. When this all started 18 months ago or so, the ICU capacity in the province was 272 beds. And in roughly June of 2020, excuse me, the premier came out and said that we can ramp up to 1,081 beds. Now, he didn't do that. And he should have been smarter. I mean, he has been told by myself and others that the solution to handling this problem without having lockdowns was to simply double the ICU capacity. And there was plenty of opportunity to do that, which solves two problems. And one of the problems is to handle any surge from purported COVID-19 patients. The second is to solve the chronic problem that exists within the general healthcare system, and that's access and long waiting lists. So you double the ICU capacity. He could have won on both fronts, but he didn't do it. And that's a failure of leadership, in my opinion. And mainly because, like I say, he's been told. So he knows that. And it's a failure of leadership by AHS as well.
Now, Dr. Modry, last December you penned an open letter to Premier Jason Kenney calling for an end to all public health measures. Now, why did you, and what was the Premier's response?
Well, at the time, I was primarily focused on lockdowns because we already knew the evidence had been mounting. And over the course of between October and November, mid-November, there were several papers that were published, not the least of which was the Great Barrington Declaration, authored by luminaries from Stanford, Oxford, and Harvard, that pointed out that lockdowns do more harm than good. So my focus was to provide a counter narrative to what he was getting from Dr. Hinshaw, and with evidence. And so every statement that I made in that December 11th, 2020 letter provided the background document for him to review. Now, he did respond, but he implemented a lockdown anyhow, despite the fact that he had said earlier in the early summer of 2020 that he made a mistake and he wouldn't do that again. So he then did respond to my letter 3 months later in March. And his response demonstrated a complete lack of understanding the science, because he did not at all respond to any of the scientific arguments that I advanced with the evidence. But what he did do is he said that we couldn't overwhelm the healthcare system, which I had already pointed out to him. And I reminded him in that article that the solution was not to lock down all of society. The solution was to increase ICU capacity and to look after the vulnerable. Really, that's all that needed to happen. All you've got to do is look at what happened in Sweden. And, you know, Sweden hasn't ruined their economy. They've managed to get through all of this without masks, without lockdowns, without social distancing. And it tells you a lot when you look at the outcomes from Sweden.
The College of Physicians and Surgeons of Alberta says since you're not currently a practicing physician, they fully support Dr. Dina Hinshaw, who they say is our current medical officer of health, which is the truth. Now, they say your specialization was in surgery and not in public health. How do you respond to that?
Oh, that's easy for me to respond. The key issue there is to understand the science. And throughout my career, you have to remember that I was also the director of the cardiovascular intensive care unit. As such, I needed to be knowledgeable with respect to the prevention and treatment of infection. More than that, when I trained at Stanford, one of the years that I trained at Stanford was in immunology with one of the world's leading immunologists. And why that was relevant, because to be the director of the heart and lung transplant program, and people who have been transplanted are immunocompromised because of the immunosuppressive drugs that we give them, they are also more prone to infections of all types: bacterial, viral, rickettsial, protozoal, tuberculous, etc. So again, I needed to be knowledgeable with respect to the prevention and treatment of infection in those patients as well. So for me, it was extremely easy to read the science that was out there. And the problem with Dr. Hinshaw and AHS is that they claim to have looked at the counter narrative, but they have been unwilling totally to actually have a frank discussion in a roundtable discussion, say with government caucus members, by individuals who do have knowledge and can provide evidence to counter the narrative. But you also have to ask the question, why is this occurring? Why has government and health authorities gone down this particular rabbit hole of insisting that everybody be vaccinated and all of these other mandates? And one of the things that I think it's worthwhile thinking about, a lot of people on the conspiracy theorist end of things talk about, well, this is all about control, et cetera. And maybe part of that is true. But really, the bottom line is the bottom line. Follow the money. The pharmaceutical industrial government complex is massive. Trillions of dollars are at stake. When you listen to Fauci speak, for example, he has lamented the fact that annual vaccinations for seasonal flu are declining because people feel as though, what's the point? The virus mutates, I can fight it off myself. So here was an opportunity to actually generate real wealth for a selected group of individuals. And I can't help but think, when you follow the money, there is a component of this. Now, one of the things that's really important as well is that just as society is more divided now than I've ever seen in my life on so many other things, so is the medical community. And many people in the medical community I know, and they would like to speak out, but they know that they're going to lose as a physician, they're going to lose their privileges, or they may lose their license from the college. For me, it's easy to speak out because when I retired after 30 years of practice, I'm fundamentally immune to be able to speak out. Some courageous physicians have spoken out, but some of them have already lost their licenses or their hospital privileges. So that's a lesson for them.
Dr. Dennis Modry is a pioneer of open heart surgery in our province. He also served on numerous hospital committees and is a member of the editorial board of the Journal of Heart and Lung Transplantation. Thanks for joining us today from Edmonton, Doctor.
My pleasure. Enjoy the rest of the day.
You too. On behalf of all of us here at Bridge City News, I'm Hal Roberts. God bless, and thanks for watching.